Hey, what's wrong?
It's nothing. I just don't know what to do with my patients. There's almost an endless amount of documentation regarding pain and bruise formation after I administer a subcutaneous heparin injection.
Wait, you are noticing this too? I expressed the same concern, and I have been reading this research paper written by AFSAR, where they developed a quasi-experimental design in assessing 4 different methods in subcutaneous heparin application. What gravitated me towards this particular study is because it specifically measures the intensity of pain experienced, as well as the occurrence of bruising, with both nominal level and ordinal level of measurement and their collection of data.
From the 4 methods assessed, what was the researcher's conclusion and what did the results look like?
Using the variance test for data analysis, the study's conclusion was that the subcutaneous injection method using airlock technique without aspiration and a 2-minute cold application was the most effective in reducing the occurrence of bruising and decreasing the perception of pain in patients.
But how would that method look in practice?
Here, let me show you. But just like the study disclosed, we must explain the procedure to the patient in order to receive their consent before we perform or administer any injection or implement any intervention.
Did the study get approved by the ethical committee at the hospital they were conducting for this?
Yes, of course. The researchers prioritized their patients over their research paper and even maintained the injection protocol stated in Table 2.
Can you show me this technique? We should also apply the same ethical consideration and get it approved as well. Or maybe show me the golden standard in administering heparin and then the suggested method that AFSAR and Kasiki have developed from their findings. That way we can differentiate between the 2 protocols. Let's start with the gold standard in the medication administration of a subcutaneous injection by Mosby's scales. I'll demonstrate it and then you can show me the AFSAR Kasiki's version. Good morning, my name is Michaela. I will be your nurse today. Could you please state your name and date of birth? After the completion of my 2 identifiers, I will assess for any contraindication of receiving heparin, as well as assess the patient's allergy history. Completing my 6 rights of medication safety, I will close the curtains to ensure patient privacy. Hi, Joe. I will be administering your heparin injection now. You may feel a slight pinch. Do you have any questions before we begin? Exposing the abdomen and draping a gown over the exposed body parts, and inspecting the skin surface for existing bruise formation. Now, Joe, you received the other heparin injection on the left side, so we will systemically rotate the injection site on the right side for this injection. Landmarking and preparing the area by swabbing the injection site with an alcohol swab, removing the needle cap from the needle, holding it like a dart. And I will pinch the skin with my non-dominant hand using my thumb and index finger and insert the needle firmly at a 90-degree angle. Release the skin by stabilizing the syringe and grasping the lower end of the syringe with the non-dominant hand.
Created using Powtoon.